How much is a session of dialysis? Number one, what does it take? Let's say somebody is listening right now, and for whatever reason, the person has been told or has a relation who is going for dialysis. What should he or she have at the back of their mind?
First of all, I'll put it out there. Dialysis is expensive. So I'm going to break it down. You have dialysis session, you have the tests, and you have medication that you have to keep using when you have these problems. Do you understand? Now, a dialysis session, at least in my center that I work, give or take, is about 45,000 naira per session. Now, note that a patient or an end-stage renal disease patient is doing dialysis 2 times to 3 times weekly. Do you understand? Optimal is 3 times weekly. So you need about 12 hours of dialysis per week to have optimal dialysis in a way that you can function well.
Yeah.
You understand? So let's just say 3 times per week. So 45,000 3 times per week. And you're doing that in a month. Do you understand? Then you are buying medications. So sometimes when your kidneys poor, some of the complications you have is you have hypertension, high blood pressure. So you're on continuous high blood pressure drugs. Do you understand? Okay. So government hospital 35,000. There are some government hospitals 40,000. So let's just say between 40 and then the private hospitals like maybe Dutchess, they are doing like 50, 60,000 there, 70,000 in some other hospitals. Do you understand? But let's just give you a range, you know. So you are buying medications and all that. And aside from that, you are doing tests. So say you come today, all of a sudden you're having sepsis or infection because people that have kidney problems are usually susceptible to infection due to their immune system is reduced or their immune response to different kinds of infections are reduced. So they usually come down with things like sepsis, UTIs, frequent UTIs, frequent respiratory tract infections, so medication and all those things. So me and my consultant did a calculation, give or take, about how much a dialysis patient is supposed to be spending per month, and it goes upwards to about 700,000 naira, 500 700,000 naira per month. So it's crazy, and you're doing that per month. Now, how much is an average person in Nigeria making per month?
Hmm.
Now let's go to transplant. So now let's say you have done dialysis for a while and you want to go and do the renal transplant. Now renal transplant in Nigeria is now around 30 million to 35 billion, and that is just transplant. That is just I'm just talking about the transplant. I'm not talking about the pre-transplant tests. I'm not talking about the post-transplant workups. I'm not talking. And then when you do transplants, after you do transplant, you're going to be on medications for life, and you have to keep those medications. You cannot stop, otherwise you're going to have kidney rejections. Do you understand? So per month, at least for the first 3 months, you are doing 500,000 naira on transplant drugs per month. That's after paying 35 million naira for the transplant, paying some more. You see some patients paying up to like 7 million, 10 million for pre-transplant workup. So you're doing your HLE typing, you're doing your scans, you're doing all those things. And that does not now mean that the donor that you bring first might be the donor that will be able to give you the kidney. Because if the HLE typing is not working well or it doesn't match, you go and find another person again. You house the person. You know. So it's crazily expensive. So if they are doing dialysis, now how long can you maintain to do dialysis? 500, 700,000 naira per month. So it's you don't know. You said someone said having a healthy kidney is good. Yeah, so it is. Oh. Hold your kidneys tight,
There is
and that's
this.
what we tell you when we concern and say, don't do this, don't do this. We're not saying it because we don't want you to enjoy life. We're saying it because we know what we are seeing in the clinical setting, and it's terrible. And then aside from the financial aspects, you're having the mental and emotional aspects. People that have kidney problems are usually coming down with depression, tired because you cannot work. Except maybe you have a business that you're doing on your own. Because nobody's going to accept you that you say you have kidney failure. You cannot, your earning capacity is limited. Do you understand? So it's usually very terrible thing to have. You understand? So yeah.
There is this statement people would say. We say it that no matter how rich you are, just having a kidney failure can wreck you and the family. You can never be too rich for a kidney failure. So, if you are listening right now, the best thing you can do is to take care of your kidneys. Having heard that this is the amount we spend for dialysis, what can we do to ensure that we don't end up in your office? We don't end up meeting you. Because see, as doctors, we tell people don't
Yes,
do
so
they say una own too much. Waiting person go do for this life. Wait. So I think there are very simple things we can do to ensure that we don't end up in the position where we begin to spend 500,000 naira every month?
So, number one thing is take a lot of water. Your kidney likes water. Your kidney needs water. Your kidney needs to be hydrated always. Take a lot of water. Do you understand? Because one of the things that can cause kidney failure is dehydration. Take a lot of water. Take a lot of water. So the recommendation is about 2 to 3 liters per day. You understand? Make sure you are taking 2 to 3 liters of water per day. It's usually very helpful. When we say when the Aproko doctor comes now and says, drink water, drink water, drink water, he knows what he's saying. Take a lot of water, 2 to 3 liters per day. So this bottle here, this is about 750 mils. Do you understand? So if you take 2 of these bottles, you are taking 1.5 liters per day. That's 1,500 mils per day. Do you understand? So we are telling you to take 4 of these bottles per day, or at least 3 of bottled water per day, if you can do that. Do you understand? It usually helps out. That's number one. Number two,
On this water issue, before you go to number two, whenever we tell people to take water, there's this comment you see, very ignorant comment. You hear people say, "Don't take water, or too much of water can buy you." I'm using the word "buy" deliberately. Say too much of water can buy you. Normally, if you take the amount of water that Dr. Sheyi has advised you to take in a day, so you spread it out, you have no problem with fluid overload, water intoxication. But whenever we tell people take water, drink water, they say like, you don't drink water because it will buy you. It will not buy you as long as you stay within the limits. You don't engage in water competition. I don't know if you've seen the video where some people will gather on the road. They say first to finish this water would give you 5,000 naira. That act can put you in trouble. Those actions where you take a huge amount of water within a short period of time, water competition, is risky and nobody should encourage it. So please don't allow anybody make you scared that if you take water, you get in trouble. What you need to know is that just take the water in within the right period of time and the amount, you're fine. Please continue. Sorry for cutting you.
yeah, so that's that. Number two, eat healthy, eat well. Eat a balanced diet. You understand? I'm not going to tell you, don't eat this, don't eat that. You understand? By balanced diet, I mean have your vegetables, have your proteins, have your carbohydrates. Make sure when you eat, you have everything on your plate. At least in Nigeria, it's not easy to have balanced diet. You understand? But if you eat rice, you eat egg today, tomorrow you eat egusi and you eat swallow. Next tomorrow, maybe you take an apple or something. You're still at least having a balanced diet. Do you understand? Then number three, avoid cigarettes, weed, igbo. It's also there's this thing about people saying it's cigarettes that is bad, igbo is not bad. All of them they are bad. All of them they are bad because if you realize, studies have shown that people who smoke cigarettes, smoke weed or cannabis, they have a potential to develop focal glomerulonephritis. That's a form of nephrotic syndrome. You understand? So if you smoke it for a long time, it's a possibility for you to develop things like that. So it's important for you to also provide that. Then aside from that, smoking too. You understand? Smoking is harmful to your kidneys.
What about alcohol?
Alcohol is harmful to your kidneys. You understand? Now I'm not saying that don't take alcohol. Okay, because I know you would come and say, no, JB, in the olden days now, they will say they can take alcohol, or in my church, we use alcohol for Holy Communion. That is not what I'm saying. What I'm saying is don't binge drink. Don't take a lot of alcohol. You cannot be taking alcohol every day and you're saying you're taking alcohol in moderation. That is not moderation. Do you understand? So that's why most of the time, when we say don't take alcohol, people take it, or if we say take it in moderation, people will say, "Should my doctor say I can take alcohol, then I can drink alcohol." No. That's why most doctors now say don't take it all together, so that you will not misquote them. Do you understand? That's why we now say don't take alcohol all together, because
I believe
you can go and take it
at all. That's where I stand right now.
exactly, because you can go and take it now and then you are spoiling your kidneys and causing issues for yourself. Do you understand? Then number three, always go for checkups. Do you understand? Now, what I mean for checkups is that you need to know if you have things like hypertension or diabetes early, because those are the commonest causes of CKD, chronic kidney disease. Now, and one of the things that you want to know is, do I have a family history? of hypertension. By family history, I mean, does my father have? Does my mother have? Do I have anybody in my family that has hypertension? Because if you have, or if you have someone like that, then it's possible that you might come down with it later in the future.
Mm.
Someone like me now have double, two-factor authentication, both father and mother. You understand? So right now, look at I have my manometer here. Even as a doctor, I still check my blood pressure every day to make sure it's within limit so that I can, if I see there's anything happening, I can stop it as early as possible. You understand? Same thing with diabetes, checking your blood sugar, going for checkups. Now, by going for checkups, I'm not saying that every day you go to the hospital to go and do checkup. You understand? But you can do it once monthly, you can do it maybe 3 times in a year. You can do so just make sure you are keeping yourself updated. Do you understand? Because as I said earlier, if you remember when I was talking, I said there are some people that would not know. They've had hypertension for a long time, but they did not know.
Mm.
And then maybe it's one day they checked and they saw that their BP was 200 and something, 130 something. And then they said that they had hypertension that they knew while they've had it for a very, very, very long time. So it's important to do health checkups. Do you understand? Number four, if you have symptoms, if you have any symptoms in your body, this one cannot be underemphasized. Go to your doctor. Stop self-medicating. Stop going to chemists. I'm not even going to say pharmacists because some people go to chemists and meet pharmacists that know because there are pharmacists that are trained and they know this thing would spoil your kidneys. I kudos to some pharmacists that I know. You see some doctors that prescribe some medication and they go to the pharmacist. The pharmacist will even tell them that no, this medication would affect this one. There will be an adverse effect and things like that. So there's some, but best still, go to your doctor. Do you understand? And so that you'll be able to actually see what is wrong with you. It's not everything that I have headache, I take anti-malaria. I have stomachache, I take anti-malaria. I have small cough, I take anti-malaria. I have this, I take, or my head is paining me, I take diclofenac, I take ibuprofen, I take, things like that. If you have any symptoms, go to your doctor. If your pee, if you are going to your toilet and you're realizing that your urine is burning, go to your doctor. If you go and you realize that your urine is cloudy, go to your doctor. If you see blood in your urine, go to your doctor. If you see you're seeing foam, you're urinating and like soap, there's soap inside the toilet. It's like soap. Make sure you go to your doctor because those are some of the signs that you might be having something related to your kidneys. Do you understand? It's very, 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 very important. Someone is asking, please, doctors, what's the normal range of blood pressure? Okay, so what we usually say in medicine is that we don't want in blood pressure we have two values. We have the systolic and then the diastolic. The one up is the systolic, the one down is the diastolic. So the one up, we usually don't want it to go below 100. Do you understand? Below 100, and we usually don't want it to go above 140. Now, some studies are even saying above 130. You understand? So we want to keep it between 100 and 130, between that range. The lower one, we don't want it to go below 60. We don't want it to go above 100. Some studies are now saying 90. We don't want it to go above 90 because sometimes when you're getting 135, 90 something, you're already having pre-hypertension. You understand? So you want to keep it around that range. So if you are seeing things like maybe 110, 50, 110, 65, that's good. If you are seeing things like 120, 80, that's good. But if you are seeing blood pressure like 140, 110, go to the hospital. Or if you are seeing blood pressure like 150, 100, go to the hospital. Or if you are seeing blood pressure like 160, 95, go to the hospital. Do you understand? It's very, 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 very important,
Yeah.
amongst other things. So, what else? What else do I want to say about this? Yes, when you want to go and do tattoos, please don't just go to any tattoo parlor around. People are using bad toxins on people's bodies, and it's causing problems with their kidneys. Do you understand? If you want to go and do a tattoo, and you say I want to do 10,000 naira tattoo, you go and find somebody. They will give you something that will spoil your kidney. You come and meet me in my office. You understand? So make sure you know what you're doing, and as you always say, as Dr. Frederick always say, good about this to say it's good health
Life.
in a sense. You understand? So always take your health as a number one priority. It's very, very important.
Wow. Thank you.
It's very, very, very important. It's
Dr.
very
Femi.
important.
This information is gold, and most times these are things that people don't get every time. Now, somebody's listening, and the person says, "Doctor, my blood pressure is high. I'm told I have hypertension. Will I come down with kidney failure?" Now you're talking about dialysis, and one very common cause of dialysis is uncontrolled hypertension. And there's somebody listening right now. This person is diagnosed of hypertension. Person is scared. Now I have high blood pressure. Will my kidney fail? What would you want to tell that person?